The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, and thank you for joining us again today for our second part in a two-part series where we have the opportunity to really do a technical deep dive on the very powerful Biscom FAXCOM solution. I'm very happy to welcome you back today where we have the opportunity to talk specifically about Biscom and the FAXCOM solution for healthcare. We are going to dig a lot deeper today in specific areas such as integrations, security, and compliance, the areas that are most important in the healthcare space. Really quickly before we get going, a little housekeeping. We go through this every day, but just a reminder, you should see on your GoToWebinar control panel a Q&A window. Please feel free to enter in any questions you may have as they come up throughout the course of the presentation. And then at the end, we will answer as many questions as we have time for. But rest assured, if we don't have a chance to get to your question today, we will have somebody from Instant Info Systems reach out to you personally, make sure you get all the information that you need. And we will also have a recording of today's presentation and yesterday's presentation available on our website shortly after this. So again, my name is Julie Fraguia, and I am very happy to introduce to you my colleague, Fernando Lopez, our sales engineer with Instant Info Systems. And we're very happy to welcome our guest presenters today, Antonietta Carboni, Director of Channel Development for Biscom, and Larry Grant, our Senior Application Engineer for Biscom. Before we get going, I just wanted to talk a minute about FACS and its role in the healthcare world. Without question, FACS is the de facto standard for secure document transmission in the healthcare market. All of you on this line already know that. And regardless of your role in the healthcare ecosystem, whether you're a provider, a payer, or a supplier, FACS is a critical component of your document delivery process. And as I look at our attendees today, I see that we have major healthcare organizations that really encompass all of these different types of organizations in the ecosystem. So FACS is everywhere. Why is that? Well, it is the cornerstone of just about every healthcare organization's document delivery strategy, and it has been for decades. FACS is ubiquitous. It is secure, it is reliable, and it is economical. And so we hear these stories about FACS is going away, and we've actually been hearing that for a little over 10 years now, and FACS is clearly not going anywhere. So that really brings us to why we're here today. We have dozens of conversations with healthcare companies every single day, and the one thing that is very clear to us is that companies are not looking to replace their FACS infrastructure. They're not looking for a new technology that will replace FACS. What they're looking for are better ways to use FACS. They're not looking for different solutions. They are looking for better solutions for their FACS infrastructure. They're looking for solutions that are more efficient, more reliable, more secure, and more economical. And that is exactly why we are here today. So without further ado, I'd like to turn the presentation over to my friend and esteemed colleague, Antonietta. Take it away.
Thank you, Julie. Hello, everyone, again, and thank you for joining us on today's webinar. On today's webinar, we want to talk to you about the importance of FACS in healthcare, HIPAA and meaningful use, and some of the applications of FACS within the healthcare industry like Epic and GE Centricity. Biscom has been working with healthcare companies to automate faxing for over 20 years. And the list you see here are just a few of the many hundreds of thousands that Biscom has worked with over the past 30 years. We continue to support and work with the largest healthcare companies around the country. Our customers include small and large hospitals, small doctors' offices, pharmaceutical companies, equipment vendors, imaging labs, health plans, diagnostic labs, and much more. Biscom products support healthcare organizations with meaningful use while also assisting healthcare organizations with HIPAA compliance. We do this by providing products that give customers the ability to ensure their adherence to requirements while also having the expertise on staff. Our customer service approach is recognized as the best in the industry. Our sales, support, professional service, and developers actively work with each other in partnership with our customers. What are Biscom customers doing? Over the next few slides, we're going to talk about some of the applications we helped our customers with. Our examples will show you why fax is vital to healthcare communications. These are just a handful of the hundreds of applications we have worked with our customers on. Fax is a common method used for exchanging patient data between EHR, EMR application, and the outside world. Production fax increases the accuracy and reduces the time to delivery. Without production fax, clinicians would have to print out the patient information and then walk it to a fax machine to send the fax, which was waste valuable time. With production fax, the documents are sent directly from the EMR application, reducing the time to send by over 95%. Users can be forced to use the native phone book within the EMR application, which increases the accuracy of the fax delivery, once again helping you with compliance. Fax delivery information and inbound faxes are available within the patient record, providing easy access to data and compiling with meaningful use. Fax is used extensively in pharmaceutical orders from clinicians to retail pharmacies, bulk order drugs, and pharmacy benefit management. Fax integration with the EMR application allows for the sending of faxes directly from the patient record using the native pharmacy list in the phone books for number information. Pharmaceutical companies providing specialty drugs use custom cover pages with barcodes to speed the delivery of mission-critical drugs. The barcodes may contain information on the drug and the closest distribution center. The barcode is read to first determine the specific drug, and then the fax is entered into the proper workflow for that drug. APIs are used to send out the confirmation that faxes have been received and request additional information. The same process is used by prescription benefit management companies to process prescriptions and refills of bulk or mail order drugs. How are they doing it? Let's be honest, most of us have experienced the pain and inconvenience of sitting in a waiting room, waiting for a procedure well after our appointment time. We assume the cause of the delay is the doctor or clinician being tied up with another patient, but we have found that to not always be true. In the past, a lot of orders were received on fax machines and stored in file cabinets, or, if you can believe it, they were placed in piles of paper. We've all seen that. Stacked so high that when we went into the office, they'd reach over their heads. As you can imagine, orders were very difficult to find when patients arrived. This required the orders to be refaxed, which delays patient care. With production fax in Biscom workflow, the faxed orders are received electronically and stored and indexed within a database. The order can be accessed by medical record number or patient name for quick access when patients arrive. Wait times have been drastically reduced in these institutions, and more procedures are being completed. And again, this improves overall customer service of all patients within those facilities. Reimbursement of patient use of certain durable medical equipment requires approval by Medicare or health plans. The prescribing physician faxes a request to the equipment vendor, and the vendor puts the equipment information on the request form. The form is then faxed to Medicare or the health plan for approval. With Biscom, the equipment companies use production fax to timestamp the inbound request from the doctor and deliver the fax to the proper employee to process the request. The fax is then sent out with the form completed, including the timestamp for transmit on that cover page. In order for the patient to get the vital equipment and the vendor paid, the completed form must contain the timestamp the vendor received it and the transmit time it was refaxed. Let's talk about meeting HIPAA requirements with FAXCOM. A discussion of fax in healthcare should always include a discussion on using fax with considerations for HIPAA. The U.S. Department of Health and Human Services accepts fax as a method of delivering patient data to outside entities. When it comes to fax and HIPAA, the main concern is protecting the transmission of patient data. In a traditional fax machine environment, organizations need to physically secure all fax machines that are used to transmit or receive faxes containing patient data. This would require having locked rooms where the machines are stored and assigning specific personnel to be in charge of sending and receiving. That can become difficult and time-consuming, which will delay providing healthcare to patients. I've seen healthcare institutions decide not to secure fax machines because it was becoming too much of a hassle, so they took the risk of losing data in order to provide better healthcare. There is a better way to provide both quicker access to data while reducing the risk and ensuring compliance. The good thing is these institutions have deployed Biscom production fax in order to provide easy and secure access to faxes by healthcare workers, eliminating the old risk. The next challenge when using fax machines is the requirement that the fax be physically placed or scanned into the patient's record. Additionally, after a fax is scanned, the paper copies need to be destroyed, which adds overhead and time away from the patient care. The cover pages included with the outbound fax that contains the patient data need to contain a disclaimer that the fax contains protected health information, and it needs to mention it must be kept private. In order to comply with meaningful use, when a fax containing patient data is sent or received, there needs to be a log kept of all transactions. When using fax machines, you need to keep the paper logs from the fax machine or transcribe them to the patient record. Both of these options are costly and time-consuming. These problems can be fixed when using a production fax with a provider that is familiar with the challenges of HIPAA. Finally, everyone, the most important factor is to partner with a vendor that has the experience working with healthcare organizations to solve HIPAA compliance challenges like Biscom. Let's talk about FAXCOM security. Biscom has enhanced the traditional fax technology specifically to help organizations meet the stringent legislation-mandated requirements for controlling the dissemination of PHI. Biscom offers organizations with their own FAXCOM servers, as well as Enterprise Edition subscribers of Biscom cloud-based fax service. The means to enhance the security of their fax network and thus strengthen their security rule compliance efforts with either or both of these two options. Integration with secure file transfer technology or addition of mailbox server component to their FAXCOM suite network fax application. In order to comply with meaningful use and have better security when a fax containing patient data is sent or received, there needs to be a log kept of all transactions. In addition to the ways in which the inherent design of Biscom fax solutions help achieve HIPAA compliance are the best practice safeguards Biscom has in place to secure its information and facilities for those customers using the cloud fax. Users who access Biscom cloud fax servers can be assured the following best practices are in place: data encryption, internal system security, server management security, and facilities security. Thank you, everyone. I'm going to introduce you to Larry Grant, our Senior Application Engineer.
Good afternoon. So now I just want to discuss some of our integrations with EMR and EHR integrations. Biscom solution integrates with many of your existing healthcare applications, and these are just a few of the ones we work with. With Epic, users can send faxes right from the Epic client. It automatically extracts both the sender and recipient information, adding the additional protection for patient information. GE Centricity EMR application. One of the most critical features of this integration is the capability to automatically fax prescription requests to pharmacies, receive in faxes into Centricity, and share medical documents via fax to the outside world, all within the Centricity EMR application. Another example would be Siemens. Siemens Novius Radiology solution enables staff to streamline radiology registration, scheduling, patient tracking, image management, and transcription. Its results reporting capabilities and PC-based radiologist workstation help radiologists work more easily and effectively. Automatic faxing through the FAXCOM server provides a secure and efficient means of communicating data. So now we're going to talk about outbound faxing within the Epic architecture. So I'm going to highlight a couple of our healthcare partners, and in particular, we're going to focus on Epic. One example of Epic is because they have the largest deployment of desktops of all EHR vendors. The combination of Epic with Biscom production fax has automated and simplified the process of sending patient data directly from the patient record. They have used the Biscom APIs to allow any document that can be printed to also be faxed out through the Biscom solution. In addition, the status is brought back into the medical record. The integration allows healthcare professionals to send faxes directly from 12 workflows within Epic, including EMR and Radiant systems. Inbound faxes can be automatically routed to a folder on the customer's network as either a TIFF, PDF, or searchable PDF image. An Epic-approved document management solution, such as Highland OnBase, will scan that folder to import the fax into the document management solution and attach a link to the appropriate patient record within Epic. So outbound faxing within Epic. Within the Epic application, a user selects a fax to send out a document. The Epic Print Services, EPS, processes the fax and hands it off to the Biscom's FAXCOM Suite software. The FAXCOM Suite software sends it to either the on-premise Biscom fax server or Biscom's fax hosted service to be faxed out. Within the FAXCOM Suite software, a retry schedule can be pre-configured to automatically retry the fax for a specific amount of time intervals. So return status within Epic. Once the fax is successfully sent, a confirmation status is returned to the patient record. The user can also see the transmission statuses of outgoing faxes in a printout. When a fax fails to be transmitted by the fax server or the fax hosted service, the Epic Print Service will return a failed status to the sender. In Epic, there is a failed fax in basket group, and when an outbound fax fails to transmit, this group will receive a message and know to investigate. Failed faxes can easily be resent from the Biscom Windows and web clients. So inbound faxing within the Epic architecture. So inbound faxes based upon the fax number, barcode reading, or caller ID can be automatically routed to a folder on the customer's network as either a TIFF, PDF, or searchable PDF image. An Epic-approved document management solution, such as Highland OnBase, will scan the folder to import the fax into the document management solution and attach a link to the appropriate patient record within Epic. Moving on to the FAXCOM CV Plus for GE Centricity. Another partner is GE Healthcare. Ever since GE Healthcare introduced Centricity in 2003, it has selected Biscom as its preferred solution for fax integration. Biscom developers work jointly with the GE developers to ensure the integration would be easy to implement, even for offices with no IT staff, and very easy to use. The integration allows healthcare workers to fax prescriptions, refills to pharmacies, referrals, charts, documents, and letters to the outside healthcare providers and patients. Clinicians are restricted to choosing fax numbers from the native Centricity phone books. Now the fax status is returned to Centricity and can be inserted into the patient record. Faxes can be received into Centricity as either a TIFF or PDF files. Faxes are picked up by an approved third-party document management application and inserted into the patient's chart. Other healthcare partners include, but are not limited to, Siemens, McKesson, and Highland-On-Base. We can also fax from any application using our print driver, APIs, and client applications. Before we talk about HIPAA compliance, let's just take a few minutes to talk about Biscom's products. So, production fax. What is production fax and how is it used? Traditionally, production fax is either high-volume broadcast faxing or is transaction processing from things like mainframes. It has evolved to also include faxing as part of a process or a workflow. It is also used to speed the delivery of electronic faxes by eliminating the need for someone to look at each fax. Delivering faxes into a workflow increases the accuracy by removing humans from the process. The dial number, caller ID, OCR, and/or reading the barcodes from faxes can be used to route faxes directly to recipients or applications. Barcode reading and OCR is used to automatically extract information from the fax, like the medical record number. This information can then be inserted into a database or into a third-party application, metafile, or many other options. So the complete fax solution, Biscom faxing solutions are available in the cloud, on-premise, or hybrid to meet every customer's needs. Our cloud solution is based on our own fax server, a full-featured enterprise fax solution bundled as a cloud offering. Unlike other cloud fax providers, you get all the functionality of a fax server, including granular user and department control, reporting, and web and mobile interfaces. The Biscom fax server is a workhorse solution for organizations of all sizes with production-level faxing where reliability and scalability matter. The hybrid solution is the most powerful combination. An on-premise fax server integrated with our hosted service for high availability, redundancy, and seamless transitions. No retraining needed since the hybrid solution provides a single, consistent end-user and administrative interface. Companies are using hybrid faxing for DR or failover to the cloud, peak overflow, and broadcast faxing. So Biscom's mission statement. Biscom's mission is to provide production-level electronic document delivery software and services for enterprises. All right. So we are now ready for any questions you may have. Feel free to put them into the GoToWebinar, and we'll take a look at them and respond to the questions.
Yep. Fantastic. Larry, Antonietta, thank you so much for that thorough presentation. And look at us, wrapping up just before 10:30. So thank you so much. Such great comprehensive information, and looks like we'll be able to wrap up and get our audience off to the rest of their day on time. I do see a whole bunch of questions that have come in over the course of our presentation, so we'll spend the next probably 3 to 4 minutes answering as many as we can. But again, if we do not get to your question, don't worry. We will definitely have somebody reach out to you directly and make sure you get that information. So I'm going to start. I will just go through these as they came in. Do you have healthcare customers moving to the cloud yet? So I'll send this one over to the Biscom team.
I apologize. Julie, can you repeat that?
Sure. The question is, do you have healthcare customers who are already moving to the cloud?
Yes. That is a great question. Yes, we do, Julie. The great thing about the Biscom product offering is that from a user and application standpoint, there is no change. So if they're using service today with Biscom and migrating to the Biscom cloud, nothing changes from the user experience or the application experience. It is the same front-end interface.
It's a very secure solution. The back end uses encryption, and it is a secure connection to our hosted data centers.
Perfect. Thank you. Okay, next question. We have many doctors on call. Is there a mobile client to send faxes directly to their smartphones? That's a good question.
Yes, we do support iOS and Android smartphones and iPads or any sort of tablet.
Yep.
Yeah, and I think we talked about the mobile interface in yesterday's presentation. So for those of you who were interested in this particular piece, if you missed yesterday's presentation, we do address the mobile client specifically. So we'll make sure we let you know when that recording is available, and you'll have a chance to watch that presentation and learn more about that piece as well. All right, thank you. Let's see. Going through my list here. Next up on our list of questions, what types of information do you commonly see hospitals communicating through email that should be moved through electronic faxing instead? That's a good question. I'm going to send that one over to the Biscom team, but Fernando, I think you're on the line as well, and I know you have a lot of experience working with our customers. If you have any input, feel free to chime in on that.
All right. Well, from as far as records go, I mean, it could be a medical record, it could be approval for an appointment, scheduling an appointment. Oftentimes, that's what we're seeing is scheduling of appointments being emailed out as opposed to something being faxed out.
Got it. All right, perfect. Thank you. Let's see. Do you use any other types of document management solutions besides OnBase for the inbound fax drop in Epic?
Well, we use OnBase because we're partnered with them. We do specify them. It's a good partnership. However, any document management solution that could do a pickup from a folder drop, we would work with. So essentially every single document management solution out there.
Perfect. And along those lines, how does the integration piece with other EHRs besides Epic and Centricity work? Like McKesson, it says, for example.
Well, oftentimes we have different methods for doing it. Like I mentioned, on the inbound side, faxes get put to a folder drop where a document management software picks up the fax and imports it into a medical record. On the outbound side, oftentimes we use a print-to-fax capability. So basically, you're in a chart and you need to fax something out. You just do file print, choose the Biscom fax printer, and it will launch one of our clients from which you can fax out.
And Larry, would you say some of those vendors will utilize our API to do the integration on their end as well?
That's always an option.
Okay.
Absolutely.
Yep. Perfect.
Can you elaborate a little bit on the Epic integration? I know clearly there's a very tight integration with Epic. Is it also a certified integration?
Absolutely.
Can you elaborate a little bit more on that relationship between Biscom and Epic?
Sure. We're a partner with Epic. We've been to their facility a few times. We've worked with their developers. The integration is done using our .NET API. It is done by their developers. It is all built into their Epic application. So we work very closely with them in developing that solution.
Yep. And just to add to that, we have a large customer base of Epic implementations with Biscom. So if there was interest in speaking to any of the Biscom customers along with Incident Info Systems, we're definitely more than willing to have them speak with you directly as well.
That is super. That would be really helpful. Thank you.
Let's
see. I think we're going to squeeze in 2 more questions here before we wrap it up. This one: we are beginning a project to move to Epic. What resources are available to assist implementing FAXCOM during this project? That's a good one. That's Fernando.
Oh, I'm sorry.
Would like to? No, that's okay. Anyone who can address this question, that's a great one.
I'll have Fernando take this one, and then we'll add it from the Biscom standpoint as well.
All right. Fernando, are you with us? You may be on mute. Antonietta, can you speak to this?
Absolutely. So just in all, in all implementations we work with all customers, there is your point person, your account manager, along with your engineer that works hand in hand throughout the whole process. So we do pre-conference calls, we do write-up statements of work on the implementation, and all resources will be dedicated throughout the whole process. So it is really a hand-holding process. It can be Epic, it can be Siemens, it can be desktop faxing. We take the same approach with every implementation.
Great, thank you. All right, and again, I think that's a great question that we'll be happy to follow up directly with the individual who asked this question and probably give a lot more detailed information specific to your project. So we'll make sure that happens. Okay, we're going to do one more question and then we will wrap up our webinar. In faxing from a folder, when we drop a completed transcript with provider ID inside the report, how is that read from the report and fax number matched up from the database?
All right, there's different methods that are being used. We integrate with multiple solutions from medical solutions. So if one of our partners does do API integration, their own application could pick up that file and we can fax it out. They'll hand it off to us, we'll fax it out. We have tools ourselves to read file directories and extract the fax number right off those outbound faxes. So there's multiple methods for doing it. We could dive into with each of the customers and develop a custom solution for them.
Perfect. Thank you, Larry.
Yeah, and the main goal, Larry, that we see with all our customers is really streamlining the whole workflow process for the users, giving them an overall cut through time and just more efficiency and time cost savings. So that's the goal in all of these implementations is HIPAA, it's meaningful use, but it's also streamlining the whole workflow process and giving them the most cost-effective and secure solution, Julie.
Perfect. Thank you both so much. I really appreciate your time. I know our audience really appreciated all of the great information today. Like I said, if any of you have any additional questions that we did not get to today, if you've posed those questions on our panel, we will reach out to you directly, make sure you get those answers. Also, if we can move on to the information slide next, we will, there's obviously phone numbers, email addresses. We welcome you to reach out to us. We have a team standing by ready to answer your phone calls and answer your emails. And certainly get the information that you need. So I hope this was helpful. Again, I'm really, really appreciative of the Biscom team for joining us for the last 2 days. And I'd like to thank everybody. Yes?
Oh, I just wanted to say thank you. It's been a great opportunity. We look forward to speaking with everyone as well.
Fantastic. Well, with that, we will say goodbye. Everyone have a fantastic day. Bye-bye.